All right, so good afternoon to our NOIAW members as well as our audience. We have a lot going on in the world, and for many of us, we have friends and family in Italy. With so many questions, we decided to bring in Dr. Ornella Punzo. She is a researcher at the Instituto Superiore della Sanità in Rome. Hi, Dr. Punzo, how are you?
Hi, I'm good, thanks.
Great, nice to have you with us. We appreciate your time.
Thank you for having me.
Okay, so I imagine you've been busy in the last few weeks, am I right?
Yes, it's quite busy. I work in a group that is taking care of all the surveillance about this COVID-19 disease.
Mm-hmm.
And although, I'm not part of the ones who decide everything, I am in this group, so my department is pretty much, has been busy for the last 2 months, let's say, and then busier in the last month.
Very good. So let's start off with the basic question. What is coronavirus and what are its symptoms?
Yes, coronavirus, it's a RNA virus, which it's a group of family of viruses that can cause a lot of diseases, very different from one another. And they go from the common cold to previously seen viruses such as MERS and SARS, which were caused also by coronaviruses. And this one is a new one. It's a new coronavirus that was not known before. And the symptoms, the most common ones have been described as fever, tiredness, dry cough. Some patients can experience also some other symptoms such as runny nose, nasal congestion, sore throat or diarrhea. 80% of the patients or of the infected people by this virus will not have serious symptoms and can recover without any support. But a minority of people can, go into more serious and even critical symptoms that need support and hospitalization.
You said as much as 80% of people could possibly have it, and only 20% actually have symptoms grave enough to go to the hospital. So there could be a lot more of us carrying around coronavirus and not even know it?
Yes. Actually, not even all the 20% might end up in the hospital, and much less than that. But what we are seeing in Italy is that, since we have a lot of people that are asymptomatic, so are not showing any symptom, but might be transmitting the virus, as some new scientific papers are showing in the last few days or weeks, we have a problem in, isolating the people that might spread the virus and continue spreading it. So it is very important here, especially, but now that the virus is spreading in other countries, it will happen the same, to put in place all these measures to, stay away, keep 1 meter distance at least between people, wear masks where that is not possible, and so on.
Okay, and do you think we're going to be able to get rid of it, and in how much time, or are we going to manage to live with it for a long time without it harming us? What do you see?
This is, I think, a 1 million question, because I think it's very difficult to answer at the moment. Mm-hmm. There are models that, mathematicians and people studying epidemiology with mathematical models are studying to understand how the virus is progressing, and when the famous, now in Italy, peak will be, but it's not easy to predict. So it is not easy to predict this. It's not easy, and we don't even know yet if all the measures taken in the last 10 days here in Italy have been effective or not, which is one main point for us. Therefore, it's difficult then to, make a forecast about the future and the next few months.
So you're saying that it has not even peaked in Italy yet. And if that's correct, how long do you see this lasting in Italy if it hasn't even peaked in Italy?
There are different opinions about that. We probably are going to need to be shut down for a longer period than only the 3rd of April, because it's very near this date. And we don't know about when the peak will be. There are different scenarios that have been put forward, so I don't have an answer on that. And I can't say how long it will be. There are different opinions. Some experts say it will last for at least a few more months. So maybe we'll have to get used to it, and people in time will get natural immunity to it. So if the virus circulates, of course, a lot of people through time get immunization because we develop antibodies towards this virus. And of course, depending on how the virus mutates, we'll see how it changes. Because we don't know how, if it becomes better or worse with the mutation. This cannot be predicted. So a lot of variables are, in the picture, and we cannot really say it will be like this, it will end with the summer. There are many, many factors involved. So we are hoping for the best, and even scientists are are not giving up on hoping that it will not, develop in the worst scenario possible. But of course, we have to hope that as it happened in China, the situation in Lombardy will not be replicated in all the other regions in Italy, and we might have a milder evolution of the situation than what we saw there.
So how do you describe a peak? How do you know you haven't already met your peak yet, and that, Italy being a #1 tourist destination in the summer?
Yeah, the fact is that we are seeing different factors. We are not seeing a slowdown in the number of infections that we see every day. Okay. We're not seeing any slowdown. The amount of people dying is not a good predictor, because we are seeing the tail of the people getting infected for the last month or month and a half. Because if the incubation period is around 14 days, the average, but it can be much shorter or a bit longer, then you can understand how a lot of people that got infected 1 month ago, then this is a kind of a long onset of disease, and people could also get worse in a few days, and not only, immediately getting very serious. So this means that the people that we're seeing dying have been infected in the last month. And we're not even seeing yet the results of the measures that we put in place, shutting down schools, and then shutting down entire towns, and then entire regions, and then the entire country that has been not shut down completely, because we have industries still working and people doing deliveries and so on. But stuff has been shut down, and we don't know yet what's the effect exactly of this, because we are still seeing people that are getting infected exponentially, and we are still seeing people that die, and the numbers are still increasing. So we are not seeing any slowdown in the situation.
With that said, does that mean do you see that people are staying home, and is that the best solution so far?
Yes, because so there are more than one problem.
Mhm.
So first, in Italy, we have a problem even in hospitals for the personal protection equipment that is not available for everyone. And even doctors have a lack of it, and the situation is difficult in hospitals to get everyone protected, nurses, doctors, etc. So this is one problem. So from this comes another problem. So we cannot tell everyone to stockpile masks and go around with masks, as we saw in the pictures about China.
Mhm.
Also because in China, they produce masks. So they have the source of that, but we don't. So there is a problem that also the World Health Organization has highlighted. There is a problem in the supply chain of personal protection equipment, especially masks. So all the ones with filters are given to the hospital and to doctors in the territory, not in hospital, just to get protection if they visit someone who is a suspected case. And for people, the best measure is to keep the distance, as they cannot wear masks, unless they are coughing, having a fever, having symptoms, so they protect others, not themselves. And if they have someone in the family or in their household who is in isolation or just discharged from hospital and still COVID positive. So there is a problem, and to limit the circulation of the virus, social distancing has been proved to be the best measure to keep. And this is what has been also understood from past pandemics. It's not only this one that is teaching something at the moment.
With that said, so do you feel, your advice to us in the United States would be obviously social distancing and staying at home, or do you have anything else that you've learned that has happened in Italy that you can say, please don't repeat this pattern, let's do it this way in the United States?
There has been an underestimation of the situation, and it's not only in Italy. I think it's been worldwide, and nobody knew that the virus was going to come and spread in northern Italy so quickly. So I think that the lesson learned from that is that this virus cannot be underestimated, that these measures have to be taken promptly to be effective, because when the virus has spread already in the community, as it happened in northern Italy, it's difficult to slow down things. So there is a role for that, for the institutions, and that is a hot topic also there in your country, but also a role for the media, because I think that the media have the responsibility to circulate news that are reliable and come from checked websites like the institutional ones. You have a lot of, the CDC and other big websites who provide a lot of information. And we do have the same sites, but a lot has been circulating on WhatsApp messages, on fake news, on Google or Facebook or whatever. And that is impairing the response, because people do not trust anymore the fact that they have to stay home and they don't have to get out or have dinner out and all that, because they don't see, the hospitals filled or the ambulances going around like it is happening in Lombardy.
With that said, you said the media has a responsibility to let everyone know, because there's so many fake news circulating on social media and WhatsApp Messenger. With that said about, having this responsibility of sharing this news and letting everyone know about the severity of it, how do you draw the line between pushing this and teaching people this is a very critical condition, and the line between that and we don't want to create some mass hysteria where everyone goes crazy, you know, and they think this is some dystopian world where it's all done.
Yeah, I think it's a very delicate and difficult moment because I think it's very difficult not to let people panic if they see, you know, all the coffins as it happened in northern Italy with no space for people to get buried and all that. It's very difficult to draw the line between the two things. Mm-hmm. But and it's also that, you know, we saw that with other topics like vaccines. If you don't see the result of things in public health, you don't see the, you know, the benefit of undergoing a measure, which is the same with this. If you are in another region and you're not hit yet, you don't see the point of not getting an aperitif at 7 p.m. But at the same time, I think there is an order of personal responsibility as citizens, getting informed from, as I said, reliable sources, and getting your part in all this picture, because actually everyone can do a lot in this. And even, you know, if, you know, the weeks before they shut everything down, I was still taking the bus to get to work, and I was concerned. So I was taking some precautions, but, you know, you can't really avoid when everyone is there, it's crowded and everything. But what can you do? You can actually start getting an idea of the fact that you haven't got to touch your face, you shouldn't touch your mouth, you shouldn't touch your nose, your eyes, which we do all the time. So you have to get conscious about this and about all these gestures that we do all the time, and they are, you know, the first thing to avoid. So you avoid that, and you get to work, or when you come back home, first thing you get your shoes out, and then you wash your hands. So for at least 20 seconds. And that is actually something that we think, wash your hands. I do it all the time. First, not everyone does it. So that is a thing that is well known, but not everyone, you know, pays attention to that type of data. And second thing is one of the best, you know, the most effective measures to avoid the spread of the virus. Because once you haven't got it on your hands and you don't touch your face with that, it's impossible that you get it if you are keeping the distance and, you know, you are not getting in any trouble with all these behaviors.
I imagine the Italians will back down from giving kisses as they usually do for a few months.
Yeah, but you see, even at work, we are used to the fact that if you don't know someone and you go into a meeting, you shake hands. And you know, it's something that you do in such a normal way that you're not even aware of it. So first thing I started being aware of these type of things. So a few weeks ago, I would go into a meeting and said, sorry, I don't mean to be, you know, unpleasant or unkind or anything, but I want to shake hands. So hi, I'm this and that's it. And all these measures, I don't know. I mean, it might be that I still got the infection and I don't know, and I have no symptoms, but these type of behaviors are the ones that should be promoted.
But going back to what you said about taking your shoes off, washing your hands, I've read some contradicting reports, and this might go back to what you said about the false news too, that, you don't want to receive any packages because they could carry coronavirus on there for up to 3 days, or you want to take your shoes off outside the door instead of in the door because coronavirus can live on the bottom of your shoe. Can you clarify this for us?
Well, I think there is, of course, I mean, here also this type of news have been spreading around, and people are getting a bit, obsessive about that. would say that when scientists say that the virus can stay on a surface for this or that amount of hours or up to days on some surfaces, not any surface. So this doesn't mean that it's easy for you to get it from a surface. It means that they studied that the virus could be still found after a few hours or in a few days in some cases. But this is not the main way the virus spreads. The main way, and we have to be aware of this, is still through droplets. So even if, asymptomatic people, so people that don't show any symptom, no cough, no anything, go around, you have to be close to people in order to get the droplets onto your face or mouth or nose or eyes. Otherwise, it's not, immediate that you get in contact with anything. You have to be in contact with the droplets.
Okay.
So
Now,
I wouldn't be obsessive. I take my shoes off when I come home. I wash my hands, but otherwise you can't even do your grocery because you have to disinfect everything that you buy. It's impossible.
correct. So once this person gets the illness and they're treated at the hospital, how long do they typically stay at the hospital? And when they're discharged, are there any other precautions for their family when they get home?
Yeah, so here the situation in Lombardy is still, in some other regions like Emilia-Romagna, it's tougher than in other regions. Like here, we haven't got the same level of crowd and people getting ill and falling ill that need medical attention. So we still can manage people in hospital when they need. There, a lot of people are managed at home unless they have serious symptoms. So only people that desaturate, so have a very low level of oxygen in their blood, getting medical attention in hospital. Otherwise, they're managed by their family doctor through phone calls or through, anything that is in the field to get in touch with people. So the situation there is different. When people get into hospital, the main thing that they need is oxygen. So the typical thing that people show when they have a serious illness, which we said it's a minority of people, is getting a low oxygen, and they don't even realize that. So they are more or less well, but then you check their oxygen in the blood and it's low. It's lower than normal and even quite low. So the first thing, they get oxygen. And in a lot of cases, if the situation doesn't progress and they need a support for their ventilation, they either get a non-invasive support with non-invasive ventilation, or if it's even, a critical problem, a more critical problem, and they're not getting better in this way, they get intubated. So we have a lot of people in intensive care intubated, and of course there is a need to get younger people that can make a better outcome into intensive care, and people with comorbidities or quite older get even normally in medicine, you have to think about who can get out of these very serious settings in which you have to intubate people.
And we've heard reports here.
Sorry. Also, just to add, they have to stay long in ICU. So they have to stay, even young people, we had experienced cases of people who have to stay 15 days intubated to get better. It's a very long period, and that's why there is a problem of strain for the hospitals and for the national health system, because you have to put these people for a very long period, and a lot of beds are saturated with people very ill, so you cannot admit other people there.
Well, we've heard reports that there just aren't as many ventilating systems and beds for citizens. Have things changed recently?
So in this, there is a problem in the fact that you never foresee, all the preparedness machine that we always listen about. It's not meant to be there either to make profit or to be, working normally. It's there just to be ready if something like this happens. Correct. And in Europe and in Italy, we had a lot of cuts in the last 10 years, let's say. So we had many more doctors and many more ICU beds and ventilators, and they are less now. So that is a fact. So this is an emergency. Normally, we don't have a problem with beds in ICU, but right. Now we have the normal people admitted to ICU. So the car crashes, the car accidents that are very bad, or people getting a myocardial infarction or whatever, and a stroke. So right. These cases are already there or are still happening. And in addition, we have this coronavirus.
Well, I definitely feel for you guys because, if you're saying that Italy hasn't even reached their peak yet, and you don't have enough beds, you don't have enough, I guess, personnel and medical supplies, it's going to be a tough road.
Well, there are some, hopes there because I recently read that they are trying to use one ventilator for more than one patient, for 2 patients. I don't know how this is set, but they're already experimenting it in Bologna. So wow. They're going to try this because, of course, we actually received material and stuff from China recently, but other countries are concerned for the fact that they might need this equipment. So other countries in Europe haven't been able to donate or to give this stuff for the moment, for the time.
We have a question from one of our viewers. The question is, what are reasonable precautions for social distancing? There are mixed interpretations here. Some still want to have sleepovers thinking their kids are not at risk. How do you feel about not being at risk?
Well, actually, there is actually a scientific background on the fact that kids are not at risk because they are not reported to have experienced serious illness or death. And we have deaths here among children either. But there is one thing, the fact that we close the schools is not for nothing. It's for the fact that even for influenza and other viruses, kids are the perfect population in which a virus circulates. They touch their mouth and their mucosa all the time, and they are very close to each other. They touch each other. They come back home, and even if this virus, luckily doesn't affect them a lot, like the flu is much worse for them than this coronavirus. Actually, they are a means of circulation of the virus, and they can get adults and elderly infected. So here you can imagine with our kind of habits with grandparents, children, this might have been, as been also said, we have to, of course, then study this. It's not something that is based on evidence, but there is a lot of concurrence of grandparents in taking care of children and
so they become little
living together. Yeah, so you can understand how the young adults and children can be a means of getting the elderly infected and even getting very seriously infected. So this is something that we have to take into account.
Okay, so we've also heard that they're experimenting with a drug that helps patients with rheumatoid arthritis. Do you feel that this is going to be a reliable cure, or are they still experimenting with all sorts of drugs?
Well, actually, recently, a few days ago, IFA, which is our FDA, let's say.
Your what? I'm sorry.
IFA is the institution that takes care of all the regulatory issues about drugs here in Italy. So IFA just announced that they launched a phase 2 trial about this drug that you mentioned, that is tocilizumab, which is a drug used for rheumatoid arthritis. The rationale of this is that there is a huge inflammatory response involved in this COVID-19 disease, especially with the expression of interleukin-6. And this type of drug can help in reducing the bad effects that inflammation has at the lung level, especially. So there are hopes that this might help. In the meantime, a lot of hospitals and in different regions are using all sorts of antivirals, the ones that you usually use for HIV, AIDS. Okay. And we are trying all sorts of combinations also with antimalarials. Hydroxychloroquine has been used in hospitals. And we in combination also in some trials with vitamin C, but this is in serious cases. So it's not something that is helpful usually in prevention.
It's funny you mentioned the vitamin C because I've already read a couple of articles of people mentioning high doses of vitamin C to help with the coronavirus, I suppose. So I was at the store the other day and I just happened to browse all the vitamins, and of course all the vitamin C's were gone. So I'm sure I was not the only person who's read this.
Well, this is why I was saying a word of caution on this, because it is not proved there is anything that prevents getting the virus or getting any serious effect of the virus. So vitamin C has been in all sorts of news here too. It can prevent the getting infected or getting serious illness, but it's not proved in any way. These protocols I refer to are in hospital intravenous injections that are in combination with other drugs, and I don't suggest that people take vitamin C orally as a supplement, because I always suggest that for vitamin implementation. Actually, it's if you have a normal and varied diet, no one needs any vitamin C orally in addition. If you eat fruits and vegetables and all the stuff that has a Mediterranean diet, you actually don't need a supplement for vitamins.
Right. Now, so we have a viewer question. First of all, before I ask the viewer question, what is a target age range, I guess, of the people that are either becoming ill from coronavirus or dying from the coronavirus? Well, let's just say becoming ill from the coronavirus. What's the age?
Well, actually, adults of all ages have been getting sick, but the worst effects and the critical illness is more common in elderly and in people with comorbidities. So this means with people with other diseases such as hypertension, diabetes, coronary artery disease.
Well, that goes with our question from our viewer. The question our viewer wrote in is, any thoughts on the growing hospitalizations of adults under the age of 50 in the United States compared to other countries, and how people are not taking it seriously? She goes on to ask, could it be our higher comorbidity issues, diabetes, high blood pressure, obesity, etc.? Many thought Italy's issue was due to higher population of older patients.
Yeah, so it's been said, and we also saw in our data that our age pyramid is not helping in this, because of course we have a lot of elderly and a lot of elderly living with comorbidities. So we are one of the oldest countries in the world with Japan. So this is one of the reasons, of course. But at the same time, it's elderly with diseases. So we are starting to make hypotheses about younger people involved. We see more males than females, but this might go with the fact that it can be a partial data that we are seeing, so we don't know yet. And at the same time, there are other conditions that we see, such as obesity involved, and this could affect your population as well. But this has to be studied more. We don't know yet, because in epidemiology, you can't see, you may see a correlation of events, but you don't know if that is a cause of something. You have to study deeply in the picture to understand if something is causing something else or not.
Dr. Punzo, we only have a couple more minutes, but I've got a couple questions, so maybe we can fit them in. First question, I'll go real quick too. The first question is, a lot of our audience have family in Italy, or they intend to go to Italy this summer for vacation. We talked earlier about Italy and how it has not reached its peak of this coronavirus. What is your opinion, just your quick opinion of when you think it'll peak again, or peak, and then what signs should we look for as to when it's going to be okay to book our tickets to Italy?
Well, as I said, I haven't got a clear idea, and I think that nobody can say, if you hear anybody saying this will go like this, and in 1 month it will be over, nobody knows this, and we just can, try to predict and then see how it goes and readjust to that. So I would say that the best word is to follow what the institutions here will say. And if they still say we need to have caution, I would go with that, because actually we are, all the other countries in Europe, even the ones that have been kind of criticizing our, being shut down and everything, they're starting to do the same, because the thing is spreading around. So I would.
Okay, so another thing is, do you feel that, could you go over real quickly about how you said that people will start to, create some sort of immunity to this coronavirus? I guess, is that over the years or over the months?
Yeah, so we don't know the natural immunity about this. So the one we all build up after being exposed to the virus, we don't know how long it lasts, and it's still under study. But we know that other coronaviruses make you develop a natural immunity, so your antibodies, for 6 to 12 months. So it's hopeful news, and I hope it will be the same for this, but we still don't know, because we are still, studying this new entity that we don't know yet. But at the same time, we can hope that a vaccine may be developed in a short time. There are a lot of different institutions are working on this, and the problem is getting it, ready to be produced on a very large scale. So it's not before 1 month, 1 year and a half that you can expect that. And that's the problem. And that is the main problem. So it can be developed real quickly, but then it has to be produced for millions of people. So that is the thing.
Okay. And last question, is there anything that we should be doing? I mean, we've talked about lessons learned earlier in this interview. Do you have anything else, any advice? And, if you could sum it up in a minute, how do you think, is there anything else we should be doing, and how serious do you think that we should take this?
I think we should be, responding, being very responsible to what we hear from Italy. And even if you are not in a state that is imposing a curfew yet or any isolation,
Right.
maybe it's a good thing to start thinking on how to reorganize our own life around different habits, because we might not see it yet. And a lot of people are under the radar anyway, even here, you know, with the public access and, you know, free access to the national health system. So a lot of people are already infected and we don't see it even in our region, even in Rome here. And so it's a good advice to start, you know, not going around all the time, not seeing people all the time, and trying to put in place all these hygienic behaviors that I mentioned before.
Okay. Well, thank you so very much. It was a pleasure having you. I feel like we've answered a lot of questions that were emailed to us and asked to us on Facebook, and a lot of my own personal questions. So I really, really appreciate your time, Dr. Punzo.
Thank you. Thank you for your time as well.
I wish you luck. So I guess you're just gonna have to FaceTime all your friends or whatever it is you do over there for your social gatherings.
Yeah, we are actually, I'm isolated with my partner, so I'm not even seeing my parents at the moment. They are locked down there, and we go to the grocery for them. So it's tough, to be honest, but we are hoping that this helps to, you know, make the situation better for the next few months.
Very good. Well, we look forward to hearing, you know, when this crisis becomes crisis no more. So, and we'll keep in touch.
Thank you very much.
All right. Thank you, and have a great week.
You too. Bye-bye.
Thank you. Bye-bye.